Hi, everyone, and welcome to this week in MHA621, where the topic and the theme is quality, healthcare quality. Um, well, it just seems that my stylus has disappeared this week, so hopefully I'm going to be able to draw with my finger, or at least put a few notations there. Hopefully it's not too distracting to anyone, but let's get started. At the end of this module, hopefully all of you will be able to discuss the focus of quality in healthcare from a user, provider, and payer's perspective. And we're going to focus on a few themes, two themes in particular, that really define quality. And I think most of what I want to focus on is going to be post-pandemic, of course, because the COVID pandemic really influenced and has changed not just healthcare, but how we think about the quality of care provided, errors in healthcare, misalignment as well. So it seems like a good place to start. Um, let's first start talking about the notion of errors as a quality of care issue. Um, the screenshot that you see in front of you is from the Narrative Matters reading, Finding Time for Compassion in a Busy Emergency Department. Excellent reading on your Blackboard site, but focuses on the idea of, medical error and how those, can cause so much trauma, not just physical, but the emotional trauma as well. Long time ago, in the late 90s, early 2000, the Institute of Medicine came out with the report To Err is Human, which at that time really caused a stir in the healthcare world, across the world, actually, even though it was focused on the United States, that up to potentially 98,000 people die every year from preventable medical errors. And since then, up till present, looking at patient safety has been foremost, so especially in acute care institutions. The Joint Commission has really focused on a number of issues as the accrediting body of healthcare institutions. And, just sort of noted four here, which in itself, are simplistic to understand, complicated to really enact. Certainly when it comes to procedures, identifying patients correctly, improving staff communication, that could be handoffs, that could just be through the use of rounds, again, focusing much more on an inpatient healthcare context, certainly using medicine safely, and infection prevention has been probably the area that has made them, at least has garnered the most attention since To Err is Human have come out. These are, for the most part, inpatient hospital errors. But we also know that quality of care medical errors occur beyond the inpatient walls, although the most severe does happen in those areas. Certainly a lot of lessons, and I would almost say silver linings, at least I hope, we, not just I hope, have come out of lessons from COVID that shut down healthcare systems, shut down outpatient areas, put a pause in healthcare. And so certainly if we look at trend lines, less errors, less patient safety issues, because certainly there were less individuals being treated. We had over 1 million COVID deaths in this country, and they were disproportionately affecting those with chronic illnesses, individuals of certain racial and ethnic groups. And so there was a great realization that patient safety issues were also connected to other factors. A short video is also on your Blackboard site, What Counts, which is really sort of the history behind the notion of identifying social needs in healthcare. And so what's listed here, the basic essential social needs, other social needs all sort of merge together to impact healthcare decisions, um, perhaps referred to as social determinants of health as well. And this, I think wonderful video really identifies how all of these things connect together for individuals, especially in urban areas and rural areas, everything from food insecurity to social isolation. Again, the social isolation was exacerbated. Um, well, let me back up and say that all of these issues were exacerbated during the pandemic and really almost invited healthcare organizations and healthcare leaders to say we can't go back to business as normal when it comes to making sure the quality of care that we provide is at a high level, especially when we have these social needs that are lacking among our community. I'd like to really discuss a little bit, although it has been discussed previously in our course, just making another link between quality, disparities, perhaps the idea of zip codes matter as well, with a little bit of a story. A few years ago, I had the privilege of serving on the board for a number of years of Echo Community Healthcare here in the tri-state region. It's a federally qualified health center. And we were, even as board members, I was, what was the term called? I was a user board member, and that just meant that I elected to receive my health care. My physician is a provider at Echo, and he still is. And so I had a little bit of a unique perspective because I wasn't just invited to sort of look at the bigger picture. I was using the services at Echo and also connected a little bit more to the clients. And the story that I remember is how an individual from our community, this community, over the course of the summer, kept going to the emergency department. I'm trying to draw a downward trend here. Usually on the weekends or in the evenings at nights when the clinics were closed, and with the same issues, the same rash all the time. And the emergency department would treat the rash through medication, ointment, and about 2 weeks later, she would come back to the emergency department again with the same issues. And there just wasn't the time in that emergency department visit to really look at the root cause of the issue as well, until she was connected with a nurse provider at Echo who had the opportunity in a first visit with a social worker to go to her apartment, noticed the surroundings, and the social worker figured out the root cause just in a few minutes, which were bed bugs, which were in her mattress area. As soon as the mattress was ejected out of the window, and I believe, to make it dramatic, it was thrown out of the window. A new mattress was there. The issue, that issue was resolved. This was a woman who worked 2 jobs. She worked second and third shift. The only time she could go to receive healthcare was when she wasn't working, which was always going to be on weekends. Any doctor's office, any clinic was closed. The emergency department was the only vehicle for that. Where she lived mattered. The type of housing, which was relatively safe and clean, except for one issue, which is really, I think, points out that even though I believe the story went 6 different times over the course of 3 months to the emergency department, that was just not the place, and yet there was no other access point for her. Now, one of the things that, certainly in the last, since 1995, at least there's been a push, is to really try and call out the patient experience when it comes to connecting to quality of care. So, and so CAPC, which I think many of you know, CAPC, or Consumer Assessment of Healthcare Providers and System, really, I think it's a wonderful term, just means patient surveys, patient experience surveys, really have been developed over time. So there's lots of different patient experience surveys. You can go to the CAPC website, which is all part of Department of Health and Human Services, really trying to garner the patient experience. These two questions that are right here on the slide here, in the past 6 months. So defining an amount of time, and how did individuals, whether it be a healthcare provider or, let's say, a receptionist, treat you, listen to you. Very open-ended questions, but it focuses on, really the idea is listening carefully and treat you with courtesy and respect. That aspect of quality is something that individuals can understand, whereas I necessarily can't understand as a non-clinician why I have this rash or why I'm dizzy. We certainly can understand, was I listened to? Was I treated with respect? And now that's a mind shift when it comes to, and a big shift when it comes to how our healthcare system reacts to that. But quite honestly, the CAPC surveys are an effective way to, especially from my perspective, from an outpatient or clinic perspective or diagnostic test perspective, dental office visit perspective, a little more challenging from a skilled nursing perspective, a healthcare, inpatient perspective, to really gather that experience, because there's many other factors built into it. So a few summary thoughts from me. There are, of course, certainly great connections between quality, social determinants of health, and disparities. Organizations like Health Leads, through the What Counts and Who Counts video, really have gone in a different direction in connecting these issues together. I think the future, certainly as we look at the patient experience, the future will land in terms of quality indicators, certainly with patient experience also, because reimbursement, either bonuses or penalties, are connected to it. And whether that's the correct way, it is the most correct, and certainly post-pandemic. I think we can learn a lot of strategies post-pandemic in terms of how to continuously improve the quality of care provided, not just the clinical care, but the patient experience care. Okay, folks, thanks so much. As usual, let me know if you have any questions related to this at any time. Take care. Bye.